Good morning, everyone. My name is Deidre Sully. I am the director of NYC Smoke Free, and welcome to our Smoke Free Housing web conference for our work group. So today's conversation is really going to be about what NYC Smoke Free is doing in the coming months, from continuing to educate landlords and property owners and tenants about disclosure to our work on increasing smoke-free housing units in the city, our collaboration with the New York City Housing Authority, and which we call NYCHA, and the educational video that we produced to help educate tenants on the impending HUD rule, which will be upon us on Monday. And then finally, the newest pieces of legislation that have gone into effect in January, and also disclosure, which will be going into effect next month. We also will be going over our local level evaluation. We've decided to look at the buildings that have gone smoke-free with the help of technical assistance from NYC Smoke Free, and kind of survey them on their smoke-free housing policies to see how that was going. So you'll hear today from two of our staff members, Lisa Spitzner, our Manhattan Community Engagement Manager, as well as Ariana Beatty, who is our Policy and Research Analyst, and they'll be discussing some of that work with you guys today. So NYC Smoke Free is a program of public health solutions. PHS is the largest public health nonprofit in New York City. In addition to NYC Smoke Free's work in tobacco control, they host a number of other direct services programs that positively impact the health of underserved New Yorkers. You can visit their website to learn more about our parent organization, Public Health Solutions, at www.healthsolutions.org. So about our presenters, so our first presenter and host is Lisa Spitzner. She is our Manhattan Community Engagement Manager of NYC Smoke Free here at Public Health Solutions, where she works to end the devastating tobacco epidemic and protect the health of all New Yorkers through tobacco control policy, advocacy, and education. Prior to joining us here at NYC Smoke Free at PHS, she worked to strengthen tobacco prevention and clean air quality laws as manager of health education and public policy for the American Lung Association of the Northeast. Lisa began her career in tobacco control with the New York State Department of Health, where she had the opportunity to involve young people in community action against tobacco use and foster meaningful youth-led tobacco prevention activities. Ariana Lee Beatty, who is our Policy and Research Analyst, will be discussing our results that we found from our local level evaluation project, and she is here with us from the CDC. Prior to joining NYC Smoke Free at Public Health Solutions, Ariana has assisted with the research on social determinants of health, focusing on reproductive health at the Harvard T.H. Chan School of Public Health, and drug and alcohol addiction at the Centers for Disease Control and Prevention. Ariana holds a Bachelor of Science degree in Community Health from the University of Illinois at Urbana-Champaign, where she contributed to the research on consumer health technologies and international nutritional surveillance. So what we're going to do now, I'm going to pass controls over to Lisa, who's going to get started with our work group discussion. And Lisa is going to have privileges in about a second. Lisa, are you there?
I'm there. Thanks, Deidre.
Okay. Hold on one second. Yes. Okay.
Great.
So
hi, everyone. Thanks for all of those who could join us today. As some of you may recall, at our face-to-face coalition meeting, I was able to give a brief overview on our smoke-free housing initiative. But today, I really want to dive deeper into the discussion and talk about what we're doing as a team and with our partners to expand smoke-free housing options for New York City residents, what we need to do more of and what we need help from our partners is to, close that gap in the housing inequality. And I'll also touch base on what's happening not only here at New York City level, but what's happening nationwide as far as in the smoke-free housing trend goes. So I want to start with why are we even talking about smoke-free housing in New York City? And I've worked in tobacco control for almost 10 years now, and I think out of all the initiatives I have ever worked on, smoke-free housing is by far the most in demand, coming directly from New York City residents advocating for this themselves, and for good reason. This is something that we know is good for health. We know the dangers that are associated with secondhand smoke. And as housing is moving forward here in New York City and around the nation, really taking more of a priority to create healthy housing. And smoke-free housing is just a piece to that puzzle. It's also good for business. A lot of landlords and businesses recognize that this can be cost savings to their bottom line. We know that a lot of times turnover costs for smoking units are a lot higher than non-smoking units, as secondhand smoke damages property. It not only can lead to fire risks and damaging property in that sense, but it leaves stains on the walls and stains and burns in the countertops and carpets and things like that. So really finding that managers are saying as they're turning over, they are saving more money in repairs. And also, as I mentioned before, it's popular among residents and owners. People want this. We live in an environment now here in New York City and around many locations around the nation where smoking is not the norm anymore. The social norms have changed. People recognize the dangers associated with secondhand smoke in the home, and they are demanding a smoke-free living environment as well. So while we've done a great job here in New York City, one of the leaders in this sense as far as restrictions and policies go for secondhand smoke exposure, you can't smoke in your restaurants and bars or workplaces, parks and beaches. Many colleges, campuses, and healthcare campuses are going smoke-free. Unfortunately, with all of these protections, the one place we are finding that New York City residents are being exposed to secondhand smoke the most is in their very own home. And for a lot of residents, their home is the one place they feel like they should have control over their health. And, in a city with some of the highest asthma rates in the country, for those who have newborn babies, for residents who are, under the elderly population or have some sort of health issue that's exacerbated by secondhand smoke in the home can be an absolute nightmare. And as we spoke about in the face-to-face coalition meeting, we know that secondhand smoke travels throughout the building very easily. It travels through things like cracks in the walls, plumbing, electrical circuits, the ventilation systems. And it's, for those of you who, haven't experienced secondhand smoke in your home, you're very lucky. But for those who have, it's a really serious health issue for them. And it shows. We do have some data from the health department showing that among children with asthma, about 53.2% were exposed to secondhand smoke in 2005 to 2010. That's an astonishing number. And as we know, we do have a lot of asthma initiatives here in New York City working to reduce asthma rates. And this is really, again, a piece to that puzzle. There needs to be more smoke-free housing, living environments for those who are suffering from asthma, because as we know, secondhand smoke greatly attributes to asthma attacks. And as mentioned before, people want this in New York City. We receive a ton of phone calls every day in all of our boroughs from residents and landlords and housing providers who want this for their building. We have to remember a lot of people have misconceptions about smoke-free housing, and some buildings ask me, well, what about market demand? If we go smoke-free, is this going to negatively affect our market demand? And it's actually quite the opposite. It's good for market demand. We have to remember the New York City smoking rate right now is at an all-time low at 13.1%. Majority of New York City residents are not smoking. In addition to that, we are now in a society where younger generations are coming up, raising families, starting lives in, a lot of our multi-unit housing buildings, and they've come from a generation where smoking is not normal. As I mentioned, there's no smoking in a lot of environments here in New York City. So they're used to that. They're demanding that, and they want that for their living environment as well. Just to drive home that point, New York City Department of Health and Mental Hygiene has their community health survey. This information shows that out of New York City residents, 77% have a no-smoking policy for their home. That means, in their individual apartments, they do not allow anyone to smoke in their home. In addition to that, break it down a little further, out of that number, 81% are non-smokers, and 53% are smokers. And I think that's something to take a key point to take away. Just because someone is a smoker does not mean that they're necessarily smoking or allow smoking in their home. A lot of times at these resident education sessions that we do in buildings, there are a lot of smokers that will speak up and say, listen, I smoke, but I don't allow smoking in my home. I take it outside. Also, from the community health survey, it shows that about 1/3 of New York City owners prohibit smoking at one or more of their properties already. So that's huge. In addition to that, about 3/4 of the rest are interested in smoke-free policies. We have worked with a number of different housing providers and landlords throughout New York City. Related has really set the example from the very beginning, kind of really were ahead of the trend, the smoke-free housing trend, decided to transition all of their 40,000 units to smoke-free. Those are their rental units. And today they continue to support their condos and going smoke-free. We've worked with a ton of affordable housing properties in New York City. And now because of this trend has kind of taken hold, we see a lot of Street Easy and other New York City real estate sites now making smoke-free a clickable search amenity. Here at NYC Smoke-Free, we've worked on, helping to transition buildings for many years now. We are really starting to see a pickup in the last 3 years, and we wanted to make sure that the public had the information that they needed to whether they want to look for a smoke-free building or they're interested in seeing what buildings in their neighborhood are smoke-free. We have created an interactive map that you can find on our website under our Smoke-Free Housing Initiative. You'll see all these plots point out, what type of housing it is, what neighborhood it is. And I should mention these are buildings that we have worked with, that we've assisted to go smoke-free. There are many, many other buildings going smoke-free, obviously without our assistance, especially new buildings that are going smoke-free from the get-go. So this map is just the buildings that we have worked with, but I should say also very, a large number of buildings that we've worked with. I should mention that since the March, which was actually the 15th anniversary of the implementation of the New York City Smoke-Free Air Act passed, and we are celebrating that. We really wanted to reach the goal of having a 15 for 15. So since it's the 15th anniversary of this law, we were hoping that we would get 15,000 units smoke-free, and I am happy to report that we have surpassed that. So again, the number of units are turning over day by day, and we are continuing to work with our landlords and partners to do that. So check out this map if you haven't. As you can see there, it's broken down by a type of housing: affordable, supportive, condos, co-ops. You find a lot of information going on this map. If you're looking for a new place, or if you're just interested to see what buildings are smoke-free in your neighborhood. And this is work that has been done over, 5 or so years, where we've been really, on the ground, working with housing providers to make this happen. And, everything we do here is evidence-based. And while we do a local level evaluation every year, Deidre mentioned, we really wanted to focus on smoke-free housing this year and look into how the buildings are doing since they've gone smoke-free. So Ariana's going to talk a little bit more about that. as far as our local level evaluation goes. And this information is really collected so that we can find out what we need to better serve those who are interested in going smoke-free or have gone smoke-free. I should mention, this is an ongoing survey. This is information that's collected over a couple weeks. This is an ongoing survey, so Ariana will talk to you about what we have found so far. So I'm going to turn it over to Ariana.
Thank you, Lisa. I appreciate that. Good morning, everyone. My name is Ariana Beatty. Like Deidre mentioned, I'm Policy and Research Analyst here at NYC Smoke-Free. Thank you for tuning in this morning to join our work group talking about smoke-free housing. Like Lisa said, I'm going to be discussing the local level evaluation that we conducted this year, which was focused on smoke-free housing. So here you have just a brief overview of the survey. At the time of the survey, which was conducted in May and June of this year, 88 buildings had been smoke-free for at least 1 year who went smoke-free with our technical assistance. The criteria did require that buildings had been smoke-free for at least 1 year in order to allow for an adjustment period so that their responses would be a little more informed. So of the 88 buildings that were eligible to participate in our survey, 23% responded, giving us total 20 responses. And here in our table on the side, you can see in which boroughs these responses came from. So when it comes to the types of housing who responded to us, while we work with many types of buildings, most of the buildings that responded to us were affordable housing options, including some affordable options for seniors specifically. About a quarter of our respondents were co-ops, and the remainder were comprised of supportive housing options and market rate housing options. It's worth mentioning that we didn't receive any responses from supporting housing for seniors or from condos, but we do work with these buildings on a regular basis. When it comes to informing tenants about new smoke-free policies, 80% of respondents to our surveys used multiple methods to inform tenants of smoke-free policies. The most common methods to use were posting no smoking signs, providing verbal information, and writing it into the lease or contract. A lot of buildings also wrote it into bylaws or house rules, depending on the type of building, and one included no smoking in advertisements for buildings. When it comes to enforcing violations of the smoke-free policy, 60% of buildings reported using more than one method of enforcement. So as we can see here, the most common types of enforcement are written warnings and verbal warnings. Many buildings also used fines, and some used eviction, and some were not sure of their response. It is worth mentioning that most of the buildings we work with do adopt graduated enforcement policies where they will start with something like a verbal or written warning and escalate to a fine and or eviction if the problem is severe. So we asked buildings how often they received positive feedback about the smoke-free policy. One building reported receiving positive feedback a few times a week, which was great to hear. 40% responded that they received positive feedback about the smoke-free policy a few times a month, which was also wonderful to hear. A quarter received positive feedback rarely, and the rest were not sure or did not regularly receive positive feedback. It is worth mentioning that this is a problem that is largely, when it's out of sight, it's out of mind, and people aren't necessarily prone to celebrate a policy that just is something they thankfully don't even have to worry about in their own home. So we were really happy to see these numbers. And that is really all I have to say about the local level evaluation. If anyone has any questions about the survey we conducted, please feel free to ask at the end. Otherwise, I am going to turn this back over to Lisa Spitzner so that she can continue discussing the smoke-free housing in our city. So here it goes.
Thanks, Ariana. As mentioned, this is an ongoing survey, so if there's anyone on the call today who is a housing provider or landlord that we've worked with in the past who has gone smoke-free and you're smoke-free for more than a year, please let us know. We'll make sure we get you the survey so we can continue collecting information. So as you saw before, our impact map, we are making great strides in smoke-free housing. And this is really where we want to talk about moving forward with this work group and our partners to continue expanding smoke-free housing options to those who need it the most. What we've been finding here is there seems to be a gap in housing inequality. And what I mean by that is a lot of luxury condo and co-ops seem to be going smoke-free, which is great because we believe everyone deserves the right to breathe clean, smoke-free air at their home. What's happening, though, is there seems to be a gap in that where affordable and supportive housing are lacking in smoke-free housing protections. And unfortunately, those living in these settings are residents who tend to need these protections the most, as affordable housing, those living in low socioeconomic status, seem to have higher smoking levels. So they're being exposed to secondhand smoke at higher rates, and those who suffer from mental illness are also have higher smoking rates. So as we know, this is not a cheap city to live in. There are a lot of residents in affordable and supportive housing who are rent burdened. They don't have the means to move to a building that has smoke-free housing options that's mainly treating it as an amenity. So really this shouldn't be a luxury. This should be afforded to all residents in New York City. So we really are working with our affordable and supportive housing partners. We do have a number of buildings that are affordable and supportive housing that have turned over to smoke-free, and we're really excited about that. But as a work group and on this call, we're really reaching out to our partners. If you are a resident in affordable housing or supportive housing, please contact us. We want to help you and your building go smoke-free. Also, if you're a partner of ours and you have connections to, affordable and supportive housing groups that you maybe want to make connections to us so that we can help them better, support them in going smoke-free, please do that. I think a lot of challenges sometimes working with affordable and supportive housing is that a lot of these organizations are understaffed. They have a lot of other issues they're working on. So we want to make sure that we get the word out that, they're not alone in this process, that we are here to help them and support them every step of the way. As you can see here, these are some of our affordable housing partners from all over New York City. I should mention I'm really excited. Our newest partner, Homes and Community Renewal, HCR. We've been, having discussions with them for quite a while now about their buildings going smoke-free, and we had a really great meeting with them and their property managers. And HCR is now moving towards supporting their buildings in going smoke-free. So if you live in a building under the umbrella of HCR, or if you know any buildings, please let us know. A lot of residents in those buildings are looking to go smoke-free. So with that said, I want to move on to what's happening outside of our local level here in New York City. Some exciting news that we've been a part of, the HUD smoke-free housing rule. So the U.S. Department of Housing and Urban Development recently issued a new regulation requiring all federally funded public housing to be smoke-free by July 30th, 2018. That's in 4 days. So this has been an ongoing process. HUD opened this rule up for comment for a number of months to get feedback from residents and partners, and it was decided that going smoke-free is in the best interest for NYCHA residents, especially since NYCHA residents report having higher asthma rates. So this is something that NYC Smoke-Free has been working hard on in partnership with the Department of Health and NYCHA. We've been sitting on the planning board and providing recommendations on how best to roll out this new ruling. So we have been pretty instrumental in providing education to NYCHA residents to make sure everyone understands the new policy and really understands what smoke-free means. As part of this education process, we were able to produce a documentary-style film that really documents the thoughts and views of NYCHA residents as well as public health professionals in this video. And it was really a priority to not just show the positives of going smoke-free, because this is a really discussed issue among NYCHA residents. We also wanted to capture what some of the concerns were among residents. Because throughout this whole process, NYCHA has really taken into consideration what the residents have to say and really have modeled the policy around residents' concerns and recommendations. So if you haven't seen it yet, please go to our website and check out the video. You can share it on your social media, send it to your partners. It's really great. The full video is 17 minutes, but it's broken down into different chapters where you can that focus on different issues as far as the implementations goes. And like I said, this is something that's going into effect in 4 days. The education does not stop there. We will be working with NYCHA to continue education as it's important to, continue these discussions as this goes into a new rule. Here, locally in New York City, there's some big things happening as far as smoke-free housing goes, and there's 2 recent new legislations passed back in August by Mayor de Blasio. So I want to touch base on those so that everyone has an understanding. We do get calls a lot from landlords and residents who are a little confused about what these actually mean. So I want to go into them in a little bit of detail and discuss where you can get more information on them. So the first was an amendment to the Smoke-Free Air Act here in New York City. The existing rule that was before this passed was that there's no smoking in all residential buildings in common areas, such as your lobbies, your staircases, your elevators. That law has existed, and it was for buildings that had 10 units or more. This new amendment that was passed last August and went into effect, actually this past January, extends that and is really closing the loophole. Because as we know, no matter how many units you have in a building, smoke travels. So what this did was close that loophole and include buildings with 10 or less units. So basically, no smoking in common areas for all multiple dwellings in New York City. So really excited about that. And the disclosure policy, which goes into effect this August, is really just a common sense policy that was passed. It's giving people the information that they need to better make a more informed choice about where to live for themselves or their family. The city already does this with bed bug disclosure, so it's very similar. And what this does is it requires all residential buildings in New York City to have a written smoking policy, a written smoking policy, and disclose that policy to any potential renters or buyers. I should clarify, this does not mean that a building has to go smoke-free. It just means that buildings have to create a written policy whether you allow smoking or not. Buildings will have to, describe where you allow smoking or where you don't allow smoking, what are the details of that. And it does need to be disclosed at the time of potential renting or potential buying. It also needs to be either posted in the lobby prominently so that people see it, or sent out annually to existing residents in all buildings. It does go into effect in August. We are working hard to educate our housing providers that we work with and our residents what this actually means. There's a lot of confusion around it. So the Department of Health actually came out with some new guidance documents that kind of clear that up and have all the details on how to comply and what this new policy means for residential buildings. You can go on our website under our smoking disclosure page. It has some 5 things you need to know about the new bill. It also has the documents. I don't know if you could see there in the bolded green, but those are the guidance documents that are released from the Department of Health. So we are working to get those out to all of our housing providers and partners so that they have what they need in order to craft their policies for August. Next steps. I should mention, as part of the great work we are doing, if you are new to the coalition, you don't know much about smoke-free housing, or if you are a resident who's interested in having their building go smoke-free, or a housing provider who's interested in going smoke-free, we do offer technical assistance to make that happen. There has been more than enough information that has been circulated around smoke-free housing, not only in New York City, but around the nation, And we have tons of resources and materials in order to go through the process with housing providers. And this is not something that, that happens overnight. It is a process. We want to make sure that not only do we have housing provider input, but we have input from the residents. It should not be something that is a top-down policy. This is something that requires a lot of education. We provide education sessions. We have discussions within the buildings with the residents and the boards and the landlords, and we help, draft the surveys and do, help draft the actual policy amendments. We offer signage for anyone who's interested. I know signage can be sometimes a cost for buildings going smoke-free. We do offer free signage for buildings if they're interested, and we also make sure to connect buildings to any association resources, because as we know, if a building goes smoke-free, sometimes these policies will spur quit attempts, so we want to make sure that residents have the proper information that they need to, make that choice and find out where that they can go to get help to do so. So that is it for now. I know we're going to open it up to questions and answers, but first, CJ, you want to talk about the next couple, or the next smoke-free housing work group series?
Yes. So just an FYI for everyone on the call, we will be having another web workgroup series next week on menthol. We're right now in the works of coordinating with our guest speaker to give you some information on menthol and what's going to be in the pipeline in New York City and what we're going to be doing. And then following that, 2 weeks after that, we will be having our in-person quarterly coalition meeting August 14th. From 12 to 2 here at our headquarters, 40 Worth Street on the 5th floor. We encourage everybody to register, as we'll be, reporting out, what was discussed on the work groups for those members who are not part of any of the work groups, and then really thinking through some of the outcomes of what has happened in the work groups. So, for example, last week our meeting was about our youth work and what we have coming down the pipeline. So we're really looking for partners to help with a lot of the activities that we're doing in the coming months, helping on planning committees for any large-scale events, as well as working through the city in educating landlords about disclosure for housing, and then also as we move forward with what we're doing on menthol. So we look forward to all of you being able to join us for our in-person quarterly coalition meeting next month. So with that being said, we're going to open it up for questions. I encourage everyone to follow us on our social media pages. There's always a lot of great information passed along through all of them. You can find the video on our YouTube page. You can also just visit our website as the videos are playing on the main page. We have Facebook, Twitter, and Instagram. So please follow, like, share, and subscribe. So with that, I'm going to open it up for questions. So I'm going to unmute everyone. So I do ask if there is background noise that you please mute your own lines on your phone. So we're opened up for questions. If you do have a question, please state your name, the organization you're from, so that so everyone can get a sense of who's asking the question.
Hello?
Hello?
Hi, we can hear you. Do you have a question?
Yes, this is Phil Konigsberg, Hello, everyone. I guess it's known that there's been a lawsuit filed against, I guess, the HUD, the federal smoke-free, and I was with a conference yesterday with Tobacco Free Staten Island, and speaking with Marvin, is it Jean-Jacques? He's aware of it, and NYCHA and I guess HUD is going forward without any skipped step. Have you heard anything more regarding the federal lawsuit that Ms. Silk has initiated?
Thanks for your question, Phil. So we haven't heard anything more than what has been available. The lawsuit seems to be against HUD, not NYCHA. And it looks like the lawsuit is on, like a basic, the government infringing on rights. However, the HUD spokesperson has said that basically they're going through as planned. So public housing will be going smoke-free on July 30th. It has not stopped anything.
No, it shouldn't.
Thanks for your question. Also, if you are unable to have your question on the live speaking part, you can also put your question in the chat, and we'll be able to read out your question and answer it in the chat. Any other questions?
Hello.
Hello. State your
Hi.
name and organization, please.
I'm David Vassar. I wasn't sure my voice was coming through. I just wanted to throw this in. I work at Fordham University. Lisa has worked with our Smoke-Free campaign for several years now. Thanks very much to Lisa and to Smoke-Free. But my feeling is that once this is underway and housing communities of all kinds are going and succeeding in going smoke-free, that it'll have a great kind of domino effect for all other communities, including academic ones like Fordham, which just hasn't taken this important step. So I think it's going to create a lot of good momentum. Just wanted to throw that in.
Thank you. We're hoping so too. I think one thing to remember, what we hear a lot of, everybody's like, oh, how is this going to happen? How can they do this? But I think it's important to, let folks know that 600 public housing authorities were smoke-free before HUD proposed a rule. And as Lisa said, there was a long comment period that was open. It was open for people to comment and give their thoughts. And the opinion was overwhelmingly for smoke-free housing. And so the rule went into effect the policy was implemented and passed on the 3rd of February in 2017.
Right.
So it's not something, kind of brand new. Smoke-free housing has been a growing trend in many cities, and especially here in NYC, our team has been working with landlords and property owners, for a very long time, and we have seen that the trend was for a lot of market rate buildings to go smoke-free. So really for us, it's been a health equity issue because people who live in affordable housing, and public housing is a set of affordable housing, those folks should also have the right in their homes and not have to endure. Most New Yorkers in general are rent burdened and can't just afford to pick up and leave. So having not secondhand smoke is a plus. Right.
Yeah. It's almost like an environmental right, really, right? And to have untainted air around you. Yeah.
Any other comments or questions? Again, you are all welcome to put your question in the chat if you do not want to speak over the live. So I think that's probably about it. Again, if there are any questions, please feel free to contact NYC Smoke Free via our email, nycsmokefree@healthsolutions.org. If there are any questions that you might think of after the fact, we are going to be continuing our work with helping landlords go smoke-free, providing continued education on disclosure, because it's like a natural question that comes up when we're working with people to go smoke-free. So we'll be doing that. And we'll also be continuing our work with NYCHA with helping to educate residents. So I encourage everyone to take a look at the video. It can be seen on our YouTube channel. And again, you can also just visit nycsmokefree.org, and the video along with the other chapters are playing on a playlist on our channel. The video does go over the thoughts and feelings and views of NYCHA residents as well as public health professionals, but it also takes you through a journey of, what the smoke-free rule is, how NYCHA is addressing it. It even talks about, health equity, because a piece of this is also trying to understand why people in underserved areas smoke at the rates that they do. And then also talking about resources that are available to help residents in New York with quit. So we encourage you to take a look at the film as it is an educational piece. And then just as another reminder, our next work group webinar is going to be next week on August 2nd at 11 a.m. to 12 p.m., and we'll be talking about our work in menthol. And then please register for our quarterly coalition meeting on the 14th. You can visit nycsmokefree.org/events to register for all of our events. So thank you very much, everyone, for dialing in. Just to let you know, this webinar has been recorded, and we'll be uploading it onto our YouTube channel once we finish processing it for anyone who has not been able to dial in. So thank you so much, and have a great day.
Okay, thank you.